moving ahead, this is the last component known as insight, right? So this component is at times also being merged with the cognitive function. It is actually a part of the cognitive functioning only, but we are going to see this as an independent component, right? So if I say to mark out the differences between a mentally stable and a mentally unstable person, what would your response be? So you will answer this question based on various things. You will answer the question based on probably their dressing sense. You will answer the question based on their reaction to certain things, reaction to questions, reaction to criticism, reaction to how they adapt into new environment. And you will also probably try to understand and try to give this answer based on their understanding of themselves. Okay, people who become severely sick, I want to bring this point here, that whenever I teach about hallucination or all these things, just think about the patient. Suppose if you have some infection in your body, what will you do? You will go to the doctor will prescribe you some medicines, and you are going to take the medicine, and within a span of 7 to 8 days this infection will actually go away from your body. Or take a very common example, you wake up with a bad headache, what do? You just pop a pill, within half an hour this headache goes away. But try to understand a patient who is having hallucination, a patient who is continuously hearing voices, will not be able to escape that. Okay, because mental health, mental disorders come with a big stigma. In Hindi we say that what will the people think? I don't want to be called a pagal in society. So just because of that fear, many of the people do not come out and share about their mental experiences, what are they experiencing. But just imagine if the person is hearing noises, whatever the person might do, they may put fingers in their ears, sit in a corner, go into the washroom, lock themselves, cover them up with everything, isolate this is not going to go away. Okay, so it is a very dangerous situation. It is a unfortunate situation in which they are. So that is why it is very important to understand, quickly observe, and start the right treatment so that they can be relieved from these symptoms. So similarly here we are talking about insight. So insight is nothing but self awareness or awareness about the disorder. Whether the patient has the insight or awareness that he is mentally sick or not, that is what is being measured by the insight scale. So insight, when we are measuring insight, it is actually measured on 6 criteria, or it has 6 types, and we grade these types. So these types are actually graded on numbers only. So because there are 6, we say that it can be 1 by 6 or 6 by 6. Okay, so 1 by 6, 2 by 6, 3 by 6, 4 by 6, 5 by 6 and 6 by 6, where 6 by 6 means the person is completely aware about his condition, and 1 by 6 means the patient does not know about the situation and is in complete denial. Okay, so let's have a quick look on the insight scores and insight scale. So you can see in the PPT that here there is first is 1 by 6, and what does it say? It is complete denial of the illness by the patient. So I'll try to put up questions. In the beginning itself I told that question framing is very important. So what do we want to assess? Whether the patient is aware about the mental condition or not. So what should be the question? Do you feel, do you think that, or do you know that you are suffering from a mental illness? In Hindi, if you are going to the ward, what will you say to the patient? क्या आपको लगता है कि आपको कोई मानसिक परेशानी है? So what can be the answer? It can be either yes or no. Majority of the patients will say, no, I do not have any mental illness. What are you talking about? I came here for getting treatment of my anger issues, but everyone has anger issues. How am I that mentally ill? I don't have any mental illness. Or they may not even accept that they have this thing. They have been forced to be here. I have been brought by my family members. My wife has brought me. I do not have any illness. She thinks that I am sick. I do not feel I am sick. If I am ill, I should be knowing that I am ill. I should feel that I am ill. Because I am not ill, that is why I do not feel ill. So this is known as complete denial of the illness by the patient. The patient will say, no, I do not have any illness. I am not mentally ill. So if the patient's response is this, we'll mark as 1/6, because we know that the patient is suffering from illness, but at this point in time he is denying that he is suffering from mental illness. Let's come to the second point. What does 2/6 mean? There is slight awareness of being sick, but need help, but also denial at the same time. So it is a mixed reaction. He has some acceptance that yeah, something is wrong, but no, this is not a mental illness. Okay. So again, if you ask the patient, do you feel that you are suffering from some mental illness or you need treatment for this mental illness? So the patient will say that maybe I am not so sure. This may be a mental illness, but this happens to so many people. I may not be ill, right? So there is some awareness that okay, this can be, but he is also denying that this is not a mental illness. Okay. So when the patient answers in this way, we say that this type is this insight is 2/6. Okay. 1/6 is complete denial. 2/6 is slight awareness with denial. Okay. So this denial now got slightly diluted. Now see how it is changing when we go further. 3/6 says, now there is no denial. Okay. 3/6 says awareness of being sick, but blaming on other or environmental factors. Okay. So suppose you ask the patient, do you feel that you are mentally ill? आपको कोई मानसिक परेशानी है? The patient will say, yes sir, I feel that I am mentally ill, but I was not mentally ill. You know what happened, this 15 days back I went to one marriage function, and there is one family member who is always criticizing our family, and he, because of him, we do not meet the entire family nicely. And that day he was very jovial and he brought one laddu, and he said that it is a good occasion, you please have one laddu. I had that laddu, and after having that laddu only, that night I started having problem. Okay. So this is what is called as 3/6, where we see that there is awareness of being sick, but he is blaming on others. He knows that he is sick, but the blame has gone on some relative. Okay. Or the person may also say that it is because of some environmental factor. I become sick when I come to this particular location. Okay. So this is known as 3/6, where the person has awareness of being sick, but blames on others or unknown factors. 4/6, awareness of being sick, but blame on factors unknown to him. Right. So what will be the person's response? Can be the person's response. So if you ask the patient that do you feel that you are sick, the patient will say that yeah, I feel that I am sick, but I don't know how is that happened. Everything was going on smoothly, things were right, and then suddenly this has started to happen. But there is something wrong, kuch to hua hai, something wrong is there, because of which I am having this illness, but I don't know who has done it or why I am sick, right? So here we see that there is awareness of the illness, but at the same time the blame is on factors which are unknown to him. He does not know what has caused. You see the progression in 1/6, there is complete denial. 2/6, the denial gets slightly diluted, that there comes slight awareness, and the denial is there at the same time. And then 3/6, awareness completely comes, but then the awareness is it actually takes a shape of blaming, where the blaming is on others and the environmental factors, and 4 by 6 is awareness that they are sick, but they do not know what is the factor. Now let's come to 5 by 6. So 5 by 6 is true emotional is internal insight. Here the patient admits that he is ill, and treatment can cure the illness. Okay, so the patient will say that, oh yeah, I am ill, I am actually suffering from depression, and initially my family took me to some local person who does some magic and all. So I went there, but nothing worked out. So I told them to take me to hospital. So that is the reason I am here, to take treatment of my illness. So what are your further plans? How are you going to do after your treatment starts? I do not know what to do, sir. I'm just here to take treatment. I know that I am sick, and probably this treatment will help me to be better again. So here we can see that the patient is having some sort of awareness that he is ill. He also knows what is the condition that he is going through, and he knows that treatment is going to fix it. But he has no further plans, or he does not know what to do in the near future. Okay, so this type of intelligence, where he has the awareness but does not know the entire thing how needs to be done in the future. So this is known as 5 by 6, also called as internal insight. And last, 6 by 6, this is called as true emotional insight and true emotional awareness about the illness. So suppose you ask the patient, okay, sir, how are you ill, do you feel that you are suffering from some mental illness? Then the patient says, yes sir, I am suffering from depression and I have come to take treatment. Actually, I have been taking treatment for the past 6 months, and I have developed some complications, so I came to show myself here. That's why I'm here. Okay sir, so what are you going to do after this? How are you going to move ahead? So the patient says that so actually sir told me to actually go for some therapies also. So probably in the next week I'll start those therapies, and the dosage has been changed, so I'll see what new doses are there, so I need to take that thing. And initially actually I was not taking the medicine properly, I was skipping medicines. So I've understood that this needs to be avoided, so I'll take my medicines properly on time on a daily basis. So in the near future I need to go for therapies along with medication, and I hope that I'll be good in the next few months. So you see how clear the plan the patient has. He knows about the disease, he knows about the medication that he's taking, he knows what has been prescribed to him, and what path he has to take in the near future. Okay, so that is why he is saying that he wants to continue with therapy and also the medication, and the doses have been changed, and he is aware that he had skipped medicines in between, and now that he has to take the medications on time. So this insight, where the person has got all the information about, or all the awareness about the disease, the treatment and the future plans, is called as true emotional insight of the patient. Okay, so this is the last component. So here there is no observation. Here we put question, and we categorize the answer given by the patient on these 6 criteria. So wherever it fits, we just fit it and give the marking score. And we actually based on this, we actually give interventions to help to improve the insight score of the patient. If the score is say 2 by 6, our goal is to bring the insight score to 6 by 6 over the course of the treatment, or over the duration. So this is known as insight enhancement, and we actually try to increase the score of the insight of the patient. So this brings us to the end of the mental status examination. It is a very detailed examination which we have seen here. We have seen a slightly concise version of it. We have not skipped anything, but we have seen in a concise manner. So last component that we saw was insight. So let's recapitulate the entire mental status examination. Mental status examination is actually done to assess the mental health of an individual at that particular moment in time. Okay, and it is also known as vital signs of the mental health, and it has got nearly 7 criterias or 7 components, where we see journal appearance of the patient, the overall appearance of the patient. Then we see the psychomotor disturbances of the patient, whether he has any or not, what type of psychomotor disturbances the patient has. Then we saw about the speech of the patient. How is the patient talking? Is the speech comprehensible or not? Is it low pitch, high pitch? All those things. Moving forward, we saw that the patient, we have to assess about the thought of the patient. Okay, what kind of thought the patient is having. So we saw that we need to check the content of the thought and also the form and stream, the stream of the thought. And we also assess the mood and effect. So mood is not based on that particular time. Mood is actually for the entire 1 week or 10 days prior to the day when MSE is being done, and whether the effect is actually congruent with the mood or not, that we have to report. And then after mood and effect, we saw perception, how perception actually changes and what are the perceptual errors. There are 2 perceptual errors that we have seen. One is hallucination and the other one is illusion. And after the perception, we had seen the cognitive component, cognitive functions, the higher mental functions, and that we saw so many things: attention, concentration, and memory, judgment, right? All these things that we have seen there, abstract thinking, intelligence, these all things were checked in the higher mental status of the patient. And then lastly, we saw about insight. Insight is the awareness of the patient about the disease or disorder. And insight, we saw that it can be classified into 6 stages, starting from 1/6 to 6/6. And after 1/6 to 6/6, we have seen that 6/6 is the higher insight, and 1/6 is the lower insight, starting from denial and ending with true emotional insight. So we ask questions in the last 2-3 components, and these questions are actually graded, and according to the grade we get the status of the mental health of the patient, and that is why it is called as MSE, or mental status examination. I hope this entire session must have been helpful and useful for you in order to understand what is mental status examination, when it is being done, how it has been done, and you will be utilizing this in your clinical practice when you are treating mentally ill patients in wards, OPTs, or any other place. Thank you so much for your time.